Thank you, Cheryl. Good afternoon, everyone. I would like to welcome panel members in the audience to the meeting of the Scientific Guidance Panel for the California Environmental Contaminant Biomonitoring Program, also known as Biomonitoring California. Thank you all for participating and for sharing your expertise and experiences. The panel last met on March 25th, 2022. The meeting including updates on the biomonitoring program activities that include community biomonitoring studies and a report back on the definition of perfluoro and polyfluoroalkyl substances, which you'll hear referred to as PFASs, which had been discussed at the November 2021 meeting. The panel, staff presenters, and audience members delved into planning for future program activities, as well as the definition of PFASs. Key discussion topics included opportunities and challenges for using biobank samples from the Genetic Disease Screening Program, expected challenges in interpreting results from the Stockton Air Pollution Exposure Project, which you'll hear referred to by its initials as SAPEP, identifying opportunities for future community biomonitoring studies and biomonitoring surveillance work, and the biomonitoring program's proposal to update the PFAS footnote on the lists of designated chemicals and priority chemicals to remove the moiety requirement, which has since been implemented, and plans to consider broadening the PFAS class definition in the future. A summary of input from the March meeting and the complete transcript are posted on the March meeting page on biomonitoring.ca.gov. I will now invite panel members to introduce themselves. First, Carl Krainer.
Carl Krainer, Distinguished Professor of Philosophy and member of the Environmental Toxicology Graduate Program.
Thank you. Laura Cushing.
Hi, I'm Laura Cushing. I'm an assistant professor in the Department of Environmental Health Sciences at the University of California, Los Angeles.
Thank you. Oliver Feen.
Hi, I'm professor at the Genome Center, professor in the Genome Center at University of California in Davis.
Thank you. Ulrike Luderer.
Hi, I'm Ulrike Luderer. I'm professor in the Department of Environmental and Occupational Health and director of the Center for Occupational and Environmental Health at UC Irvine.
Thank you. Tom McCone.
Hi, I'm Tom McCone. I'm a professor emeritus at the School of Public Health at the University of California, Berkeley.
Thank you. Jenny Quintana.
Hi, my name is Penelope or Jenny Quintana. I'm a professor of environmental health at the School of Public Health at San Diego State University.
Thank you. And now we'll hand the floor over to our chair, Meg Schwarzman, who will provide more details about today's meeting.
Thanks so much, Vince. I'm Meg Schwarzman in the Environmental Health Sciences Division at University of California, Berkeley School of Public Health. First of all, before we get started into this meeting, I just want to acknowledge and thank Ulrike Luderer, who stepped in at the very last minute to chair the March meeting when I was suddenly unable to. And I appreciate your stepping in a pinch like that. I want to start by announcing the panel goals for the meeting. So we're going to hear updates about both program activities and community biomonitoring studies. And then the program would like to hear input from the panel and the public about priorities for future work. After each presentation, as usual, there will be time for questions from the panel and from the audience. So a bit now about kind of logistics for this new format, which is both in person and remote. If SGP members want to speak or ask a question, just raise your hand, like physically raise your hand, and I can see you. I'll call on you at the appropriate time, and you can ask your question or provide your comment. Webinar attendees who have questions or comments during the question periods can submit them via the Q&A feature of Zoom or by email to biomonitoring@OEHHA.ca.gov. We won't be using the chat function during the meeting, so don't try to ask questions by chat. And you can just keep the comments brief and focused on the items under discussion, and we'll read aloud relevant comments, paraphrasing them if necessary. If online webinar attendees want to speak rather than provide written comment, during the public comment periods and discussion sessions, you can use the raise hand feature in Zoom webinar because I can't see you, and I'll call on you from using the raise hand feature. If you're attending in person and wish to comment, you can come to the podium or raise your hand, and Stephanie Jarmel, who's in the room, will call on you at the appropriate moment. And for the benefit of the transcriber, please clearly identify yourself before providing a comment and write your name and affiliation on the sign-in sheet if you're in the room. So to get started with our first presentation, I want to introduce Kathleen Attfield. Kathleen is Chief of the Exposure Surveillance and Epidemiology Unit, which is part of the Exposure Assessment Section in the Environmental Health Investigations Branch, or EHIB, at the California Department of Public Health. She will give an update on current program activities.
Just testing to see if you can see my slides.
That looks perfect.
Okay, wonderful.
Yes.
Okay, thank you. So good afternoon. Again, I'm Kathleen Attfield, representing the program today for our overall program updates. Today, I will walk through several updates on the administrative side of things, our surveillance projects, and updates from our 2 laboratories that are part of the Biomonitoring California program. So first, to review our budget, you can see on the right-hand side, probably the part that interests you the most, fiscal year 2022 through 2023, how we have the continuation of the budget augmentation for the Biomonitoring California program. And additionally, the recently signed budget has confirmed the permanent funding addition for air pollution-related biomonitoring work as related to Assembly Bill 617 that passed in 2017. With the budget augmentation, we were very fortunate in being given additional position authorities, and we've been working very hard over the past year to advertise for and bring in new staff, and that's included new health educators, a health program manager, and laboratory research scientist, manager, and fellows. Our work is not quite done. We still have a number of positions to fill, including research scientist, epidemiologist positions, from entry level to branch advisor level, and in the laboratories, research scientists from levels 1 through 3 through a supervisor and another fellow. So I appeal to everyone on the panel and those listening in to our meeting today to either to share this information, and those of you who are interested in applying, please check out our CalCareers website for more information. We'd like to welcome those that have been hired since our last SGP meeting. So Amanda Hooker, Emily Kadim, and Judy Wang, as well as soon to be joining us, Ilaria Lentrichia and Amber Kramer. We are wishing well to Sarah Huber, who has been reducing her time on the program in preparation for retirement, and to staff who've moved on to other positions, including Faye Andrews and Simon Ip. So you can see we've had a lot of change happening within Biomonitoring California, and we're really excited about the expanded capacity that we will be having and do have with our new staff members. So to move on to our surveillance project updates, I'll first talk with you about the Biomonitoring Exposures Study. And this was one where over the last few months, we undertook a new initiative to create population-based estimates of the biomarker concentration distributions that we have by working with a survey data consultation company to weight the data to the underlying population of the region. Now, for those who are not familiar with or need refamiliarization with our BEST study, so this was a collaboration with the Division of Research of the Kaiser Permanente Northern California. And this was one of our earlier studies and one of our first initiatives to try to do a more regional surveillance approach for the state to understand a population level exposures. So it involved a stratified random sample of adult Kaiser members from the Central Valley which you can see highlighted in green in the map on the left. So I'll be talking with you about the expanded BEST portion of BEST, and that was the larger portion of the study that took place in 2013. It incorporated 341 people, and its recruitment had a special emphasis on sampling of Hispanic and Asian Pacific Islander Kaiser members. So the targeted recruitment allows us to create more precise estimates for those groups, but it did mean that overall study demographics were disproportionate to the underlying population. So to show you that, the boxes have moved again, but I think we get the idea. By design, the Asian and Spanish preferring Hispanic groups and rural groups were overrepresented, which the addition of the weighting that we have done helps to correct for that in order to make overall population estimates. These weights have now been applied across all our chemical panels, and we have quite a number of them for the BEST study. This includes metals, phenols, quite a number of panels for the pesticides, perchlorate, phthalates, polycyclic aromatic hydrocarbons or PAHs, the PFASs, polybrominated diphenyl ethers or PBDEs, and polychlorinated biphenyls or PCBs. So we're going to be adding the weighted data to our data portal of the Biomonitoring California website. And so I'd like to show some of the differences to the unweighted data so that those who are using BEST data for comparisons to other studies can best understand which version is of most use to them. And that is a question we have of the panel actually, is how can the program convey the utility of new weighted data to stakeholders and other researchers? So here we see how the weighted geometric means are lower than their unweighted values for blood mercury, urinary mercury, and urinary arsenic. The geometric means, as I said. So a little bonus information, just because of the way that the sampling was done and the stratified design, and the way the weights use the joint distribution by urban rural, it allows us some better estimates of when we get down into the stratified concentrations by these different variables that we're interested in. So ones where you start seeing some differences between the population are here with the older age group being higher for blood mercury, and for the Asian group with also blood mercury being higher, as reflective of the Central Valley. Moving on to an update on CARE-LA and CARE-2. These surveillance projects, like in BEST, we have been weighting the data to reflect overall regional population biomarker concentration distributions. And we've been prepping the weighted data to be uploaded to our website's database. So that has made the ways we are structuring our data portal a little more complicated, which I'll talk about later when I talk about the website updates. So we are in the draft phases of the CARE report and that we had described at prior SGP meetings, and are including some useful infographics like those shown on the right, as well as describing and listing out in tables the demographic trends in the data on age, gender, race, ethnicity, income, and education. So we're very excited by this data product and look forward to it coming out in the fall. Next, an update on CARE-3, which took place in San Diego and Orange counties in the beginning of 2020, but was stopped early due to the COVID-19 emergency. For this study, we had a goal of between 300 and 500 participants and had invited 532 people to participate. But by the time we shut it down, only 90 people had been able to complete the study. So unlike CARE-LA and CARE-2, we do not consider this group of people representative of the underlying population. We consider it more a convenient sample, so we are not weighting the data for CARE-3. However, we are still making the data available, and I'm going to give you a quick description of some of the findings of the chemicals measured, which were metals, PFAS, and environmental phenols. So for the metals, they were detected almost universally in blood. We saw lead, mercury, and cadmium and manganese in over 95% of participants. And in urine, we saw arsenic, cadmium, and mercury in over 88% of participants. In the Biomonitoring California program, we follow up with people who have levels above a certain threshold for 4 of our metals to help them identify possible routes of exposure to reduce their exposures. And in CARE-3, we had 9 participants with a metal level above a relevant level of concern. For PFASs, probably not surprising to many that we still are detecting them in the vast majority of Californians, and specifically in these 90 participants. On average, we saw 7 PFAS. The most commonly detected were PFOA, PFOS, and PFHXS. These levels were pretty similar to CARE-LA and CARE-2, and similar to the previous CAREs, they're also lower than the national estimates that we see provided in NHANES. And 2017-2018 is the most recent set of years available for NHANES. So it's a little temporally different, but the best we can do at the moment. We wanted to update you on one of our big priorities, which is trying to expand our collaborations. And we want to extend the impact of the data that we have. We've been working with the Stockholm Institute with Matt McLeod on pharmacokinetic properties of PFAS using the CARE data. And most specifically, the first part of the project they've been working on has been looking at the differences in differences or non-differences in peak intakes for PFAS between California and national levels. And we're hoping that that can be presented to the panel in the fall SGP. We've been working with the California water boards on bringing together CARE biomarker data with drinking water data for PFAS in order to help them with their processes of creating new maximum contaminant levels for various PFAS. And lastly, we have been working with the Silent Spring Institute, which is a nonprofit research institute, into occupational exposures seen within the Asian Pacific Islanders projects that we have. And though we are staffing up with recent new funding, we still have lots more data than we can currently attend to. So we welcome the panel's suggestions for other types of collaborations we can undertake. To update you on our new surveillance work, employing maternal serum samples from the Genetic Disease Screening Program, we are in the planning stages where we are able to accommodate the lab analyses of 500 samples per year. And so, as one might expect, we've been reviewing a lot of PFAS literature. We've been consulting with PFAS researchers. We've been assessing budgeting, timeline, and logistical constraints, and trying to assess the potential for our work to address different types of surveillance questions. So we are currently putting more of an emphasis on the time trend aspect of the surveillance work as recommended by the panel in our last meeting. But we are also exploring an alternate year design where we can make use of both banked samples, which are available for some counties in California, and non-banked samples or freshly collected samples, which are available in other counties of California. And this also relates to a difference between the amount of volume of the sample available. So a low volume with banked and a higher volume with the freshly collected samples. So this allows us in one set of years being able to look retrospectively and prospectively on PFAS trends. but also on our alternate years allows analysis of other types of analytes that can be tracked in this media of the serum, and non-targeted analyses because of the greater volumes that this represents. We're also reviewing prior data that we have and that the lab has analyzed quite a number of samples from prior years from the GDSP, from 2012, 2015, 2016, and that's also of different areas of California with 96 to 292 samples. And then, of course, we have a lot of permissions to gain with our IRB application and our biobank request to GDSP. And as recommended by the panel last time around, expanding our collection of variables and our linkage to potential health outcomes, we're also applying to vital statistics to be able to match pregnancies that are tracked in vital stats as well as through the biobank program. So that's going to be a boon for our surveillance work. So moving on to updates from our 2 laboratories that make up Biomonitoring California. So first, the Environmental Health Lab out of the California Department of Public Health. They have 3 methods that are in progress at the moment: VOC metabolites, mercury speciation, and PAHs with the action of transferring to a new analytical platform. Details there if you want the gory details. And then with untargeted analyses, the advancements that have taken place in reference to parent compounds in blood and environmental samples involve the installation of a new Adjournment machine, as well as for unknown metabolites in urine of training new staff to use the HPLC Q Exactive Plus platform. For the Environmental Chemistry Lab at the Department of Toxic Substance Control, the siloxane method that they have initiated on 4 of these siloxanes listed there is involving the GCMS and SPME sampling system. They've completed their migration of the legacy method that we've had for 12 PFASs to a newer instrument, and that's bringing the wonderful benefits of decreasing analysis time by 50%, but also decreasing the necessary volume necessary for the analysis. And this has been validated and added to their ISO accreditation. In progress is the optimization of an extended PFAS method. So moving from the 12 standard PFAS, potentially up to 43 PFAS here. This includes new to us PFCAs, short chain and long chain, as well as new generation PFAS compounds, GenX, Adana, F53B, and these 3 have also been added to the CDC's PFAS method. And in addition, many other notable PFAS. For their, yes, I see, sorry. In this method, they are trying to modify their serum method so that they can have an equivalent method for PFAS in plasma. And that's in the early stages, but pilot results with paired samples are showing the success and plausibility of this approach. So I'm going to end with some information about new resources that are available on the Biomonitoring California website that I hope everyone will go and look into. So our designated chemicals list has been updated, and this is routinely done when the CDC updates their lists of chemicals that they are analyzing for. So we have a fair number of compounds that are listed there, also including several VOCs and pesticides and nickel. I want to especially note that based on the work of the prior March SGP meeting, that PFAS definition change is now reflected in the designated chemicals list and also in our priority chemicals list. As I noted before, the CARE3 data is now available up on the website. And we have a new CARE LA lay-friendly study summary that can be found, and that's available in English and Spanish. So with that, I will defer to the panel for any questions that you may have and the public. And I'd like to thank all of our participants and our collaborating organizations for making all of these projects a success, and especially our very dedicated staff. So thank you.
Thanks so much, Kathleen. We have 10 minutes now for questions, clarifying questions from the panel and from anyone else attending the call. And then we have a longer 25-minute discussion period. So just to break those into two sections, clarifying questions for Kathleen. And if you're a panel member, I'll see you raise your hand. And participants on the meeting can use the raised hand function if they're on this Zoom meeting, or present in the library. I think I saw Oliver, please.
Thank you. That was very informative, and congratulations to these acquisitions of new instruments and the transitions to faster turnaround times or shorter run times. It's great. I wonder, in terms of these two untargeted assays, the GC QTOF as well as the LCQ exactive. I understand untargeted analysis means, you know, we are not very sure what we're looking for, but we hope for the best. But still, you need some, how can I say, libraries or ideas what to look for. Is there a concept?
I'll need to defer to whichever laboratory you're specifically interested in. Was that EHL or?
That was mostly for example, the LCQ executive. That was, you said the HPLC-Q executive was purchased, and there you go, this one.
Okay.
Right. So you had a GC-QTOF, and the staff are being trained, and I wonder if there's a concept or a plan how to utilize these instruments, specifically the Q executives.
This is Jeff Wagner from Environmental Health Laboratory Branch. I don't see Xiaowen Xie on the participants list right now. If you're on Xiaowen, he's the director of this activity. But I can't say that I know that he's been concerned about various, quantitation accuracy issues that have to do with additional metabolites of certain target compounds of interest, and looking into that as a way of making things more comprehensive. But I can get in touch with him and have him follow up with you if you like.
Hey, Jeff.
I see him.
Great.
Xiaowen's
here.
Xiaowen.
Yes. Thank you, Professor. And you are right. With the LCQ, thank you, Jeff, also. Q Executive Plus, library is a big issue. And untargeted, I completely agree with you. Untargeted still need to be defined under certain domain and certain thing we might know. So for the Biomonitor program, we start with build a designated chemical database, priority chemical database. We also build a database on the environmental flow group, PP3 groups. So we try to start with the class-based library build up, but definitely, like your work, Bing-based database, any commercial database, like Thermal's database, and software from Thermal. This machine is from Thermal, so Thermal's Mass Frontier, any database we try to learn to build up. So I don't know that's I answer your question or what's the?
Yeah, also like offer help if we want to talk about it more online, offline, so to say, strategies and whatnot. I just wanted to raise that. Congratulations to the instrument, but also happy to engage in discussions.
Yeah, thank you very much. We really like to learn from your metabolomic centers and the pioneer work you have done, and then definitely the offline discussion. This is a very challenging topics, and then even in at the CDPH, we have I try to form MS. We call it some kind of clubs to bring this issue to discuss. But work with you will definitely be very helpful. Yeah.
Jenny.
Hi, thank you for that update. I had a question about the human subjects approval. Could you just remind me, these samples you're getting, the maternal samples, these are not going to have results returned to them, is that correct?
That's correct, because we received them in a de-identified fashion.
But you're going to receive them de-identified and have them linked to the birth record, but all of it's linked but de-identified, is that what you're saying?
Correct.
Okay, yeah, because I do have concerns with non-targeted analysis, because you're able to pick up drugs of abuse and things like that. So I think there's a real issue with that, especially if the database is made public somehow that could be searched by somebody for compounds that you don't report even. So I just do think there's ethical issue to finding stuff you weren't looking for, which we run into in our studies just in house dust, finding a lot of things.
Kathleen, may I give a comment on the issue? This is
Sure. I'm just going to acknowledge that. Thank you. That's a very valid concern, and we'll take it into account for our planning. And then I think Narissa has a comment for you afterwards. Go ahead, John.
Okay. Yes. And the machine actually, we call it the full scan method, does have that issue, but the technology allows us to build the excluded list, inclusion list, so which will exclude the drug we might be concerned. As long as know which chemical we don't like to locate, we can tell the machine, do not acquire the data on them, do not, so the complete untargeted can still be guided, be selective. So that's a technical comment. We might able to solve that issue by the exclusion list or other technology.
You have to have a pretty complete list.
Yeah,
that's really great that you can do that though. Thank you.
Narissa, did you want to add something?
I did, thanks. Jenny, I appreciate your concern. And this is something we've talked about in relation to samples to which we have participants connected. And it's one of the reasons why we haven't done non-targeted or semi-targeted screening with the CARE study or other participant studies. The other is that I think some of the results are a little harder to explain to participants. And so we don't want to have so much uncertainty when we're returning our results to our participants. So these samples offer kind of a unique opportunity because results return isn't a part of it.
Thank you.
And just from my understanding, results return has been such a central part of biomonitoring programs work and really in pioneering, developing those methods and developing really helpful information for participants. And I think that's been a big contribution of the program. But I know that's, if I understand right, it's partly like established in the when the program was established. So have you had to do something to kind of get around that in this situation where the samples are de-identified and there is no possible way to inform participants? I think this has come up before, and so forgive me if you're having to repeat something that we've talked about, but if you wouldn't mind restating it.
Sure. I mean, the requirement of returning results for participants is part of our ethic of our program as well as part of the legislation. So as long as we can, as long as we do have participant identification, we make the results available. In this case, those identities are just not available by policy of the biobank. Identification is not available. So it's just not feasible for us to return results. That said, you're correct that we still want to use this as an opportunity to provide education and awareness of environmental exposures. And so we're fortunate we now have a health education group, which is going to be really focusing on strategies and, who is our audience, and really boosting that part of like, how do we get information out to, it won't be the same participant group, but to stakeholders who might be impacted by these exposures.
Thanks, I appreciate that. And also, I'm also, while simultaneously so supporting that work and that effort that's in the ethic and the founding legislation of the program, I'm also glad it doesn't preclude the program from using the GDSP samples. So that sounds like a nice way to navigate it. Other questions from the panel or from other attendees for Kathleen based on her, or other members based on Kathleen's update? Kathleen.
I was just going to add something to the prior question, in that the kinds of studies that the OEHHA group is taking on with various community groups, we still have the ability to develop and refine our results return materials. So I just want to make sure it doesn't sound like we've moved away from it completely as a program.
Thank you. Any other questions based on Kathleen's update about the program in general and the changes that are being made, the weighted data? If not, we'll move on to our discussion questions. So we have some time for discussion among the panel members and anyone attending the meeting around some of the issues that Kathleen raised in her presentation, particularly around the new weighted data. And some things that I think, so I'll just mention some things that the program wants feedback on, but there's also, any comments or discussion points that the panel wants to raise are fine too. So one is this question around communicating the new weighted data. So are there, sort of how best can the program convey the utility of that data to a range of stakeholders, other researchers, and communities? The program also wants input on how the program can expand the impact of the biomonitoring study findings for communities and other stakeholders, like where else should this information be going and used by whom, and how can the program facilitate that? And then finally, Kathleen talked about new collaborations and also the fact that there's more data than available hands to analyze it. And so they're looking for suggestions from the panel for expanding collaborations on existing projects and to analyze existing data. So any thoughts on those topics from the panel members? And since we're still sharing your screen, Kathleen, do you want to put your list of questions up so that people can continue to refer to them?
I have them broken across 2 pages so I can slowly move between the 2. And for the question about collaborations, we actually threw in a couple examples because I know it can be a kind of abstract type of question.
Then maybe we should start on, let's start on the first 2 questions that are on your first slide, Kathleen, and we'll treat collaborations separately since you've broken that down, and we can go into a little bit more detail. Any input from the panel on these 2 questions? Jenny.
I haven't read your material, your outreach material, but I don't want to sound crabby or anything, but I think it's important to point out the limitations of weighting. I mean, if I remember, the population skewed higher income. And so just emphasizing we'd like to have more studies that were completely inclusive, you know, in the future, I think would be helpful. I mean, not to take away for the huge effort that you did, that was great, but I think we still could do better in terms of really including the most disadvantaged populations in the state. And so I'm not sure if it's worth kind of at some point just mentioning that you know, it's our goal. It's our goal to do that. And then I'm wondering, I know you don't have much money, but I'm wondering if it's worth trying to do a few focus groups of maybe even state agencies that work with different populations. So in terms of what do they find interesting about these findings, do they relate to their populations especially? And I'm just thinking one example that tobacco related disease research program has these institutes that focus on priority populations, different priority populations. And they could see whether the priority populations had found these of particular interest to the community or something like that to kind of extend the reach or something like that.
Ulrika.
Yeah, kind of related to what Jenny was talking about. I recall that for the CARE-LA and the let's see, the CARE-2, I guess it's called, studies that you worked with community groups in the area, you know, to get the word out about the studies. And I'm wondering, are there, you know, one idea might be to go back to those, you know, via those community groups. You know, I don't know whether you would have the bandwidth to be able to, now with more staff that you're hiring, which is wonderful. I was really happy to hear that, to maybe do some presentations, you know, where you can actually go out, go back to some of these groups that helped with the recruitment and getting the word out to present some of the study results to those communities.
Kathleen, you're unmuted, which made me wonder if you were going to respond, because I had actually the exact same recommendation as Ulrika did, but also around a question of what are your current interactions with the community groups that you've worked with at the outset of a study with around, you know, you do results return to individual participants, but what is the current setup? Or what have you done, like in CARE, working in terms of communicating results and findings to the community groups that you worked with? I'm thinking also of there's some community groups that sent representatives to one of our meetings. It was probably a couple of years ago. Anyway, I'm thinking about that as a different level of results return rather than individual results, but working with the community groups who have been good partners to find out what education and outreach is useful to them, what the results mean to them, and what else might be needed. Is the program already doing that kind of work? And if not, what does that sound like?
Right. For CARE-LA, we did an initial report back to an environmental justice meeting or focus meeting of the California Air Resources Board in Los Angeles, and invited all the organizations that had supported our work there. And we have had more plans to get back to CARE-LA and CARE-2 community groups. And I'm going to defer to Narissa on this one, because as you say, now we have some expanded capacity to make good on our intentions. So Narissa, are you ready to chime in here?
Yeah, sure. So we did have plans. Our intent was always to hold some kind of public meeting following each CARE region. CARE-2 would have been right when we were in CARE-3, and of course that was shut down because of COVID. So now it's an opportunity for us to think about what that might look like now that people are a little more accustomed to Zoom meetings and we have a little more bandwidth as a program. We are also, now that we have the lay-friendly CARE-LA document that's been posted that Kathleen mentioned, we are planning on putting something like that together for CARE-2. So we'll have another tool that we can use to to bring those results back to the community. I also want to mention that the ACE study, which is going back a few years now, we did meet with the community, both the broader community, but also the community organization that helped us recruit APA Family Services. And we did that in conjunction with the San Francisco DPH to talk about ways that DPH could then follow up with them and maybe work on some strategies for exposure reduction. But that's something that we have not gotten back to, but it's something we really look forward to with our expanded capacity.
Great, thank you. Tom, did you have a comment?
Well, most of what I was interested in has been covered. I mean, the same topic is how to reach out to the communities. I guess the only thing I would add to it is if there are other channels, maybe social media or like the neighborhood groups or something where you could put out the information or at least put out a link and let people know this data or this information is available. And if they're interested in what's their exposures to chemicals, there's one way of looking at it. And again, that's a little different channel than working through the leaders, but it's probably, I mean, a lot of people, if you get it in their social network, they'll spread it around one to the other, sometimes very quickly. And I mean, there's a risk to doing that the information could get augmented or biased or misinterpreted through those channels. But it was just a thought.
Kathleen, do you want to go to the next slide that has the expanded thoughts about collaboration?
Come on, come on.
So is this list, just to clarify, Kathleen, are these, this is the data that you have or the data that you haven't been able to analyze, or just these are describe
kinds of initiatives that we've sort of started on, but not been able to take too far. So they're just projects that are burning a hole in our pockets that might burn holes in other people's pockets.
I think in the previous meeting, we did talk a little bit about this larger data package that we were hoping to come out with, which included all of our studies. It was more of an index of data that we had, but it's a little overwhelming. So Kathleen has distilled it down into sort of a hot topics list. I'm hoping that will whet somebody's appetite.
The metals one we especially highlighted because we've been in conversations with the Minnesota Biomonitoring program that has had also some arsenic exceedances there, and they've been challenged a bit with how to convey some of the finer points and methods of avoiding particular exposures through rice and fish. So we're interested in expanding our work to be able to help provide better guidance.
Laura.
This is more of a question than a helpful suggestion, but we're all at academic institutions and work with a lot of students, and I'm still getting up to speed as a new panel member on all the varied activities of Biomonitoring California, but I certainly work with a lot of graduate students that are hungry for projects and looking for data. So do you have already, internship programs or fellowships? Some of the, the challenges, at least for master's students, they're not there that long, and so it would have to be a small project. But for PhD students, of course, it could be longer. So do you already have mechanisms to kind of collaborate with students and their faculty advisors and bring them in to maybe be collaborators on some of these ideas?
We've already had a history of working with both master's students and PhD students in the past, and I'm going to defer to Marissa for like the funding mechanism aspect of it, because I know that's always appealing and a way of bringing more people on. We have set up MOUs with various institutions if it's going to be a very large kind of venture. And Marissa, can I defer to you for further elaboration?
Sure, there are a bunch of ways in which we have worked with trainees from students to graduates. We have EIS and CDC fellows, and we have CSTE fellows, but current students, it somewhat depends on what they're looking for. If it's a capstone project in which we're like an advisor and providing data, we can certainly do that, but it's a little harder if the student's looking for like an on-site work experience where they'd be interacting with staff. I mean, the whole workplace has changed. We don't really have an on-site work presence anymore, and we don't actually, funding for interns is a little harder to come by now. But if somebody's looking for a data-only project, I think that's something that we should talk about. We have worked with UC Irvine, we've worked with UC Berkeley, so we'd be happy to talk to you more about possibilities of collaborating with students.
I've had this in the back of my mind for a while as a something that's kind of has been maybe tapped into only piecemeal, and wondering if there's a way to make it a little bit more readily accessible and generalizable, like well, Laura, you could say more if you think this is the case with your students, but I get the sense that there's an appetite for some certain number of like data only projects, right? Like there's students at various levels who need data to do their capstone, or and then anywhere from capstone all the way up to dissertation. And if it's dissertation, then it has to be a good match with their advisor's work and has to be connected somehow to their original research. But I wonder if there's a way to kind of facilitate those connections in more than a one-off way. So it would involve like the program summarizing some of the data or types of data that are as yet or under analyzed, and pushing those out to some identified group of faculty members, some way to lower the activation energy for making those connections. And I think maybe it takes an offline conversation between both sides to figure out what has to happen to make that be the case. But it's something I've been sort of trying to see my way through to for a while.
I think some of it depends on what would happen with the data once it's analyzed, and how much, obviously, how much of a role the program would have to play in that. If somebody is hoping to publish the data, obviously we'd want to have a fair amount of interaction. If it's really an academic exercise where lots of people might be looking at the data in different ways and it's kept within the academic realm, that's a really different level of supervision or input that we would need to have. So yeah, I would agree that we should talk about this in more of a programmatic way rather than we happen to know this one student, because that will help us, I think, open up possibilities. And I think both are actually helpful. I mean, one is helpful in more of an academic realm, but the other is helpful to us as a program getting data out. But I don't think it's an either or situation. We could do both of those things.
Great. I have Ulrika and then Oliver.
Yeah, kind of related to the what you were just saying, Narissa, that whether it's going to be published or if it's more of a kind of an internal academic exercise. I mean, I think if we're involving, say a master's student who's doing a thesis or a doctoral student doing a dissertation, then, there's an expectation that it will be published. at least as, the thesis or the dissertation. So, and hopefully actually as, in peer-reviewed manuscript, manuscript form too. So I think that probably would be, I think my sense is that there would be a lot of students and faculty members who would be interested in doing something like that. So I think working that out up front is really important, things like, authorship and all sorts of questions that could arise around that. So I think that is something to really think about, kind of as Meg was saying, sort of more generally, because I think it's something that'll come up multiple times.
Oliver.
Yeah, and I would like to encourage also to make this available via public announcements, but carefully crafted language in the sense of which data or which samples would be available for which purpose, right? So that it's not overarching. It's not like everyone can use everything for everything, but it's clearly like where the program would say, we would love to do it, but we don't have the bandwidth or the right people. And we think that would be interesting to investigate, but it's not the highest priority, perhaps. But it's certainly worth publishing. So that way, you can basically expand your collaborations, actually without costs, because many academics wouldn't have otherwise the knowledge of the data or the samples, and they might also not have the ability to acquire similar data. So it's kind of like, I think I can see it as a win-win for both the public as well as for the program, as well as for the academics, just saying. But it has to be carefully crafted, so that people exactly know what they can apply for or gain access to or have a conversation with.
Jenny.
Hi, I had two comments and a question. The first comment relates to what we're talking about with students or anybody. The CDC biomonitoring data has a whole process for asking permission to use it for a thesis, and a lot of students have used it for a graduate thesis or dissertation. So they have a whole process and forms and procedures, and you maybe could look at those rather than trying to reinvent that procedure. And also making sure timelines are very clear. If you need to approve their thesis and it takes 6 months, they need to know that ahead of time, in case they want to graduate, that kind of thing. And I'm forgetting my other comment. Oh, my other comment was for this slide that's showing here, you're mentioning interest and difference by race, ethnicity, but I would also really recommend that you look at differences by income as well. Anytime you look at race, ethnicity, as in terms of disparities as well. Just to add that, you probably meant that as well, but just to make that more explicit. And then I also wanted to know, and I probably should know this already, and I apologize, but is it ever a possibility to propose studies? So this would be probably a proposed study with additional funding, obviously, that recontacts participants. And I mean, a simple example might be the Asian American population with high blood mercury, a dietary questionnaire asking about fish consumption, but also what parts of the fish, there's cultural differences in eating like the head or the whole fish or something. And I'm just curious if that's ever a possibility. And you probably discussed this already, but apologize, to do further analysis of data.
I'm going to not answer the gist of your question, but the context of your question, and that we actually do have that information already. It wouldn't involve a recontacting. So that's something that is also a matter of, we'd like to return to it as soon as we have some new research scientists on staff or collaborators who are particularly interested in those questions. We have like what type of fish you've been consuming, what parts of the fish, and I've looked at some of that, and the parts of the fish are definitely interesting for PFAS, but that's a teaser to throw out there. As far as recontacting goes, Nurse, I'm going to defer to you because that's not been a general practice of the program unless really necessary.
We haven't. I mean, you could go back. We'd have to go through an IRB amendment, and I think it's not out of the question, but I think we'd want to think about how old those data are, or I mean, how long ago those participants were involved with a project of ours. For example, ACE 2016, 2017, we'd be recontacting people after quite a long period of time. So I would think we would want to think carefully before we reach out to people again. But again, like if it's something about going back to care that's a little more recent, I think that would be more feasible. I'm just thinking from a both because we lose people, they move and are harder to follow up on, but also just because their memory of the study may have faded by the time we contact them. But the ACE questionnaire, Rich, it's on our website. We asked a lot of questions that we would not normally ask in an exposure questionnaire.
That's probably a bad example because I was just trying to give an example of something you might want, which you already have. But does your current consent form include any language about recontact? Because we've kind of started including a question in our questionnaires, like, if there's a future research study, would you agree to be recontacted? If we want to do some further research on this study, would you agree to be recontacted? And a lot of times people are very happy and interested to participate, but without having that permission, it would have been harder for us to get a permission by the IRB to follow up on some participants. I'm just kind of curious what the questionnaire says or what the consent form says.
We do not currently have that in our consent form. If you remember when we first started talking about the CARE study back when it was the multi-regional study, we did think that maybe longitudinal follow-up would be a part of it, that maybe we would be able to write that into a consent and into the study design. Didn't happen, but that's a good suggestion. We've also thought about adding some other things like, could we pool your study and then just expanding the informed consent to give us a little more latitude with what we do with the samples or with the data. That's a good suggestion.
We do ask of our participants if they would consent to further analyses of their samples down the road.
I want to take this moment to check with Cheryl if there's any public comment in this section, anything that's come in on the email or the website.
So I don't see anything in the Q&A, but a while ago there was a raised hand by John Gallardo, I believe. Don't know if that's still relevant. If so, please raise your hand. Okay.
And then I'll check with Stephanie about anybody in the room.
No comments from the room at this time.
Okay. Thank you. Then I want to just give it another moment where we have another 7 minutes before we have to move on. So I want to give another moment to see if there's any comments or feedback in this conversation, this set of topics, before we move on to our next presentation. So anything from the panel on what we've been talking about or something that we haven't talked about yet, but with regard to these questions from the program. And if not, then we will go ahead and move on. Jenny, maybe you could lower your hand just to keep it clean.
Sorry.
And we'll move on to our next presentation. For our next presentation, I want to introduce Susan Hurley. She is a research scientist in the Safer Alternatives Assessment and Biomonitoring section of OEHHA. Susan will provide an update on current community biomonitoring studies and on planning for future biomonitoring studies. And we'll do the same thing with a presentation by Susan and then 10 minutes for questions and open discussion and input after that, including some questions for us as a panel.
Okay, thank you, Meg. I hope everybody can hear me okay with my mask on. Yeah, okay. So today I'm going to be giving an update both on our current community biomonitoring studies, as well as laying out some of the thoughts we have for planning our future studies. So I will start with our Stockton Air Pollution Exposure Project, also known as SAPEP. I know a lot of you have heard about this before in prior SGP meetings, but just to remind you what the primary objectives of this study were or are. First, it is to learn more about air pollution exposures to school children in Stockton, and then to evaluate the effectiveness of school air filtration at reducing those exposures. So the field work for this study was completed at the end of last year in December. It was conducted at a school in Stockton over the course of 2 consecutive weeks in early December. The sampling and the field work was done the Monday and Tuesday of the weeks of December 6th and December 13th. And as part of that field work, we collected urine samples for biomonitoring, as well as air quality data and survey data on exposure information to help inform the interpretation of the biomonitoring results. So the urine samples have now been analyzed for metabolites of polycyclic aromatic hydrocarbons, or PAHs, also for stable metabolites of the volatile organic compounds, VOCs, and we've also measured metabolites of nicotine to account for smoking exposures. The samples have also been analyzed for a select number of biomarkers of oxidative stress and inflammation. And so right now we are conducting the descriptive analyses of the biomonitoring data in preparation for preparing our results return packets to the participants of the study. So today I won't be presenting any of the biomonitoring results, as we can't present any of the summary findings until we return the results to the participants. So what I will be sharing today is some preliminary data on our the air quality data that we collected. And we collected information on a number of different pollutants. But today I'm just going to be sharing some of the results around fine particulate matter, or PM2.5, and the black carbon data. So information on these pollutants were collected through the placement of measurement devices co-located at 6 different sites throughout the school, including 2 in outdoors on school grounds, and then 4 indoors, including 2 classrooms that we installed portable standalone air filtration units in, and 2 classrooms that did not have these air filtration units. So we used, for the air filtration, we used the IQ Air Health Pro Plus. These IQ Air units are certified to filter almost 100% of particles greater than or larger, greater than or equal to 3 microns in size. The teachers were instructed not to turn off the IQ Air filtration units. And then this shows the 6 locations of the monitoring devices. So it's got, let's see if this, how well this pointer works. The 2 outdoor locations, and then these are the 4 classrooms. And just note that the classrooms that have the IQ Air filtration are classrooms 3 and then classrooms 4. The PM2.5 was measured by purple air monitors. These provide continuous real-time PM 2.5 measurements by utilizing 2 laser particle counters, which then estimate the particle mass by light scattering. And the data is logged at 2-minute intervals. And prior to deployment, the sensors were calibrated to a local federal regulatory monitor. And these sensors are still at the school and continue to operate and provide publicly available data on the PM 2.5. The black carbon was measured by aerosol black carbon detectors. These provide real-time black carbon concentrations at 1-second intervals, and it's based on an optical reading of the particles collected on a glass fiber filter. So the results I'm going to be sharing today, these are preliminary analyses of the PM 2.5 and black carbon data, focused only on week 1, and I'm only showing week 1 because it rained in week 2. It rained a lot, so it really cleaned out the air, and those data are likely to be much less informative than the week 1 data. I'm also restricting these analyses to the time period 8 a.m. Monday through 3 p.m. on Tuesday, and that's just because it takes a while to set up these devices. They weren't all deployed at exactly the same time. So that is the time interval during which we have contemporaneous data for both PM and black carbon. And then prior to analyses, the measured data were converted to hourly averages. So these preliminary analyses include both an evaluation of the temporal trends in these 2 pollutants, as well as a comparison of the air concentrations in classrooms with and without the IQ air filtration, and also in comparison to the levels measured outdoors. And I just want to take a moment to give a shout out and a huge thanks to McKenna Thompson, who is a UC Berkeley MPH student who's been interning with us this summer. And she's really the one who took the lead on these analyses and created all the plots that I'll be showing today. And then I'd also just like to acknowledge Rebecca Shugru, who is also at UC Berkeley. She's finishing up her doctoral degree, and she did a lot of the processing of the data collected by the black carbon monitors. And she's also helped us with some of the interpretation of the findings. So this first slide shows the hourly averages for Monday at 8 a.m. through Tuesday, 3 p.m. And the gray areas show just the hours of when school is in session. So that'll be important later on when we integrate these findings with the biomonitoring data, because that's when the kids will be there. Let's see. So basically, you can see this is just the outdoor levels, and it shows higher levels in the evening, which is typical of the winter pattern that you see in this region in the valley. And then looking indoors, you see a very similar temporal pattern, although the levels are lower than what's seen outside. This is the classrooms without the IQ air filtration. And then when we look at the levels in the classrooms with the IQ air filtration, we generally see the lowest levels in those classrooms, but we do see this weird sort of high blip on the first day in the afternoon. Also, it's worthy of noting that we see the biggest differences in the overnight hours. So for black carbon, we see a really similar pattern outdoors where the levels are highest in the overnight hours. We see consistently lower levels indoors. This is with no IQ air, and then the lowest levels are in the classrooms with the IQ air filtration. And we don't really see that same high blip in black carbon that we saw with the PM 2.5. So this is just another snapshot of the data showing the distributions of the PM 2.5 across the 3 different locations. And you can see that the levels are highest outdoors and lowest in the classrooms with the IQ air filtration. And the medians were statistically different across these 3 locations. And again, we see the same general pattern with black carbon, where we see the highest levels outdoors and the lowest levels in the classrooms with the IQ air filtration. So just to summarize briefly, the findings of, these are preliminary findings, but we do see the levels of both these pollutants were higher outdoors than indoors, that the air quality was improved in classrooms with IQ air filtration compared to those without. PM 2.5 median levels were 22% lower, and black carbon median levels were 54% lower in the classrooms with the IQ air filtration. So for SAPEP, our next steps, in addition to drilling down more deeply into some of these air pollution, air quality data, is we are working to prepare the packets with the kids' individual biomonitoring results so that we can distribute them to parents this fall. In the fall, we also are looking to give presentations at community meetings to disseminate the initial study findings. And we also are working to do the descriptive analyses of the biomonitoring data so we can get those data posted on the program website. Then we need to do a full integrated analysis of the biomonitoring, the air quality, and the questionnaire data to really comprehensively evaluate and address the project's primary research questions. And then, down the road, we will be disseminating the final study findings to relevant stakeholders. So the other community biomonitoring study that we're currently conducting is Biosphere. And this is a biomonitoring study where we added biomonitoring onto an existing exposure study, in this case, Sphere. And Sphere is funded by the California Air Resources Board, CARB. The PIs on it are Asa Bradman from UC Merced and Betsy Knopf from UC Berkeley. And the objective of Sphere is to assess the exposures to air pollutants and noise among 90 parent-child pairs living in Fresno and in Stockton. And it includes household air monitoring and sampling for selected criteria air pollutants, including black carbon and VOCs. Also includes personal air sampling for PM 2.5 among the adult participants in the study. And it's also including information on noise and using a questionnaire to collect additional exposure survey data. So Biosphere then, under Biosphere, all Sphere participants will be invited to provide urine samples. And those urine samples will be analyzed for the same suite of chemicals that are biomarkers that we're measuring in SAPEP. So it'll include metabolites of PAHs, VOCs, and nicotine, as well as some biomarkers of oxidative stress and inflammation. And Biosphere also will support some additional air sampling that'll help us interpret the biomonitoring results. So the fieldwork for this is scheduled to begin next month and will continue through next spring, so it will span all seasons. And then we expect the biomonitoring results to be available sometime in 2024. So those are our current studies. And those both SAPEP and Biosphere were supported by one-time funding. Now, the good news since we last met is with the signing of the state budget earlier this month, we now have ongoing contract funding to support doing more of these community biomonitoring studies in communities that are heavily burdened by air pollution. So the state funding allocates $350,000 a year in annual contract funding, which can be used to support academic and community partnerships to help conduct these studies. So, and then the funding can also be used to support the measurement of analytes that Biomonitoring California labs don't currently have the capacity to measure. So for this fiscal year, we just found out we got the funding for sure a couple weeks ago. We're under a very short timeline to develop a study, write the contract, get it executed so we can launch it before the end of the fiscal year. So we've been focusing on finding existing air pollution studies that we could add biomonitoring onto. So much like the approach we used in developing Biosphere. So in looking for such opportunities, we have been focused on identifying studies, ongoing research studies that focus on underserved and heavily burdened communities, that expand the program's geographic coverage, that have community engagement activities already in place, that are collecting complementary air exposure and health data and/or health data, and that offer the opportunity to provide results that are actionable, that can be translated into avenues to reduce exposures, or information that can help inform that anyways. So our process for identifying these an existing research study that we can add biomonitoring to has really just involved us keeping our eyes and our ears open, and directly reaching out to scientific colleagues and community-based organizations who have an interest in air pollution. We've been reaching out to colleagues such as folks at CARB who may not be actively engaged in air pollution research projects themselves, but may be aware of projects that would offer good collaborative opportunities for biomonitoring. And we've also been having discussions at public forums such as this one to solicit ideas for these short-term planning efforts. And at our last SGP, a number of you offered some ideas, and we've been following up on those, as well as some others. And we think we have a few good potential prospects for this fiscal year and possibly the next. Now, looking further down the road, we will continue to look for existing studies that we might add biomonitoring onto, but we really want to develop a little bit more of a systematic long-term strategy. So we're planning to develop a request for information, which the goal would be to identify opportunities for these future biomonitoring studies. And it's likely that we would issue this in 2023 so that it could help develop the studies that would be supported by contract funds, probably starting in fiscal year 2024, 25. So just thinking a little bit more about the RFI, we've just started having some discussions about what this might look like. The program has done prior RFIs, but that was a number of years ago. About 12 years ago, we issued an RFI that was aimed specifically at academic researchers who were collecting or had recently collected blood or urine samples from California residents. And that RFI was designed to identify those studies where the program's lab could then add biomonitoring to those studies. And the goals were really of that RFI were to support ongoing epidemiologic or exposure assessment studies by enhancing their studies with biomonitoring data, and also to provide the program with additional data to support its goals. So now this RFI that we're talking about now for our community biomonitoring studies is really a little bit of a different thing here. In addition to soliciting ideas from academic researchers, we really want to get ideas from community leaders and organizations. We also, while the primary focus would be to identify projects that address air pollutants of concern, I think we all recognize the importance of evaluating those exposures in the context of cumulative impacts of other environmental stressors. We are interested in getting information on projects that address other environmental concerns beyond just air pollution. And I think we want to both collect information or ideas that would help us design a new biomonitoring study like we did with in developing SAPEP, as well as continuing to identify studies where we might just add on a biomonitoring component to an existing study. So as a program, as I said, we're just in the early stages of thinking about the development of the RFI, and this is something we'd like, if anyone in the panel and the audience has ideas of what that process and the product might look like, we would love to hear about it in the discussion session later. So then this is just sort of how we see things unfolding over the next several years. I know there's a lot of information on this slide, but the point is to show sort of there are many steps involved in developing these studies, and they take time to plan and to execute. Let me start by just walking you through how to read this figure. So this column over here just goes through generally what the steps are involved in developing these studies. And then going across are the fiscal year. Each column represents a new fiscal year of funding. So just generally the steps involved, first we need to explore potential collaborations. In the short term, we're doing that through, as I said, reaching out to researchers who are conducting existing studies, but ultimately we're thinking we'll use an RFI to do that. Then once we find out, get a sense of some good opportunities, then we need to choose the project that we're going to move forward with. And then a lot of the work comes next in this development phase, where we need to figure out all the sampling scheme, the fieldwork protocols, develop IRB protocols, and write the contract and get it executed, and by the end of the fiscal year, so we can initiate the fieldwork. So for this, for last fiscal year, this is Biosphere, and we now have the first 3 steps all done, and we are about to initiate the fieldwork next month, and then we expect that study to be done in June of 2024. Then for the fiscal year that we just began, as I said, we're in progress for exploring potential collaborations. We're hoping to identify a project partnership later this summer, and then we'll spend the fall developing the study protocol and all the things that go along with it, as well as the contract, so that we can get out in the field next spring, and then that study would finish in June 2025. And then for the following year, fiscal year 23-24, we'd probably continue to employ our short-term strategy of finding existing studies to add a biomonitoring component onto, while we also would be developing this RFI, so releasing that sometime next year, so that we could use that then as a tool for our longer-term planning, starting with to develop studies that are supported by fiscal year funding 24-25 and beyond. And then I just want to note that this is a little bit of an oversimplification. It shows one study being conducted with each year of fiscal year funding, and each project being about 2 to 3 years in duration. That is pretty ambitious. And we are looking for ways to combine some of the fiscal year funding so that we might launch a new study every 2 years or so and extend the duration. But that's sort of a general picture of how we're seeing things unfold over the next few years. So that's all I have for now. Thank you for your attention, and I'd be happy to take questions.
Thanks so much for that update, Susan. And congratulations on the funding. It's exciting, and it's going to be exciting to see what comes of it over the next bunch of years. So we have time now for questions, like clarifying questions for Susan from the panel and from all attendees. Carl.
Yes, thank you. I think it seems to me the study you're doing is terribly important. At least some of the things I've read suggest that the Central Valley is one of the worst places for air pollution around. And I'm wondering to what extent you have an understanding of the general health, adverse health of pollution before you start your study. That's question one. For both children, you're looking at children, but maybe you have some idea about adults. It turns out it looks like air pollution is a universal contributor to several different disease endpoints. And Gia, would be great as a result of your work to identify, some of these adverse effects. I was struck that you're going to be considering heavily burdened groups. And that raises the question, who are you studying now? The students are from what kinds of socioeconomic groups? Are they heavily burdened or not? Or, are they well-off people from Stockton, or are they burdened people from Stockton, or whatever? Anyway, that's a collection of questions I think that your study raises, and I would be interested in any answers you can give. Maybe not down your pipeline exactly, but I think it's potentially very interesting to study.
Yeah, so thanks for those questions. I think to answer your first question about health, yes, you're right. The valley is very heavily burdened by air pollution, and they also rank, by Cal Enviro Screen. They have some of the highest asthma rates. I think it's the top 5%. A number of the health indicators in Cal Enviro Screen have indicated a very disproportionate burden of health, adverse health in the community. Now, our study is, you may recall, the actual participants, we only have 18 kids in our study. We're not going to be able to look at the health effects, within our study. But we will be able to, hopefully we will be able to show the degree to which school air filtration may help protect them from, the air pollutants. Or not, I shouldn't say protect them from lower their exposures.
Yeah.
And then in terms of who's in our study, we do have information on their socioeconomics. I don't have the numbers off the top of my head, but it's a heavily burdened. I mean, it's a disadvantaged community. I do recall the principal saying that it was the majority of kids qualify for school lunches. It's primarily, I think it's about half Hispanic. Yeah, so these are, despite it being it is a parochial school, it is not like a prep school, it's, it is designed to reach kids who are disadvantaged, yeah. Did I hit both of your questions?
You hit some of them.
Okay.
I have a couple more.
Okay.
Asthma would be something that would show up with children, but it turns out, and I know this is outside your pay grade, outside California's pay grade perhaps, but air pollution has quite adverse effects apparently, of course, on lung diseases, cardiovascular disease, diabetes, strokes, and if you could find somebody to pair with you, might be worth checking with adults and see what any connections there. I know that's outside what you're doing, but at least I'm learning naively, air pollution is a nasty substance.
Yeah. And I think, one of the things that our study can also provide is, clearly we can't look at health outcomes directly in our study, but we are, we left those purple air monitors behind. And so those are going to continue to provide more detailed data about the exposure levels in this community. There's only one regulatory monitor in the area. And previous research has shown the importance of these hyperlocal exposures that aren't necessarily captured by those monitoring data. So, we're contributing little pieces to the puzzle, I guess.
Sure. One more quick question, if I might. I think there's a Harvard study, or people connected to Harvard, that suggests that the current EPA standard is maybe not woefully, but substantially inadequate. And I'm wondering what you're seeing in terms of the general monitoring of the community and what the concentration of air pollutants is. It's a good thing your filters work. And I'm wondering, I guess, if you pull the exposures down to the extent the filters will, how well off are the kids in the classroom, for example? How well off could people be made in the community if they had analogous filters?
Right. Yeah. I can tell you that during our study, the levels of PM 2.5 were below the federal regulatory standard. I think not much lower, but a little lower. But typically in this area, they have quite a few exceedances of the PM 2.5 level. And I don't think there is any, and someone on the call might know, but whether there are any recommended levels for indoor exposures. I don't think that there are, but I think there might be a movement to develop those. But yeah, good points.
Thank you for answering the panoply.
Jenny.
Just a couple suggestions. Minor suggestion, I'm sure has already occurred to you, is that black carbon presumably has only outdoor sources, whereas PM 2.5 has outdoor and indoor sources. You could ask the teacher what they were doing at 3 p.m. jumping around doing the hokey pokey or something to make that big rise indoors, right?
Yeah.
But so I think that it's really encouraging that the black carbon, was reduced so much. And did you leave the air filtration devices in place
at the school? You mean afterwards?
At the school afterwards?
Yes, we did.
Okay, so then you'll have continuing data on the PM on the purple airs, right?
Yes, yeah, and we are actually intending on looking at those data. Yeah.
Mm-hmm. And in terms of contacting researchers, 2 suggestions. One is there might be researchers not directly doing air pollution studies, but in our school public health, there's a lot of people doing activity, health promotion people, increasing activity in the community, and they have lots of people wearing monitors, and they show exactly where they went, and taking biological samples from them. And for many pollutants, you can have these estimates from near road exposure, et cetera, which are pretty good based on location. And there's models for a lot of communities. So there's this kind of, and they have a lot of these biological samples that they take often to look at, you know, direct health benefits. So that's one suggestion. And the other one, I was just trying to figure out how to take advantage this natural experiment of COVID and increased air filtration in a lot of schools and stuff like that. I'm not sure if anybody had taken any samples, you know, before, and maybe encourage them to take them after these, you know, these increased filtration that was put in place in many of the schools for COVID reasons.
Maybe we could pin this just because we have a longer discussion time following question and answer. But I think those are two great things that we could just put. Will you remember them, Jenny, for a larger discussion? Thank you. And then Ulrika for questions.
Well, one of my questions was already asked by Jenny, which is whether the IQ air filters were left in with the school. The other question I had kind of related to that, I don't know, maybe I misunderstood it, but it looked to me, I think you said that the biggest differences between the outdoor, I think it was both the carbon black and the PM 2.5, between the classrooms that had no IQ air filtration and those that did was overnight. So I was just wondering, so were they leaving them on overnight, or, you know, or did I misunderstand what you said?
No, that is what I said. Yeah. And they were instructed to leave them on overnight. And, you know, we're not sure exactly why we see the biggest differences there, but a likely explanation is that the doors are definitely closed overnight. So that's when we would see the biggest, and windows. The windows were never open anyways, but, you know, during the day, the doors were often propped open because of COVID. But at night, when the doors are closed, we're thinking we can see a bigger difference in the air filtration.
Thank you.
Thanks, Tom.
Unmute. I had to find the unmute button. So again, I guess just a clarification. So the purple airs were indoors and outdoors, correct?
Yes.
And so to characterize the exposure, I guess most of the time was indoors, and you don't know a lot about their home environment other than it might be related to outdoors. I mean, so in terms of total exposure time, we just basically get the school time. I mean, a comment is, I have a purple air indoors and outdoors, and they are quite different. Even in an area with relatively clean air, we get much different readings indoors and outdoors. But one of the issues with the purple air is you can't really, at least the ones I have, you don't really turn them on or off. I mean, they're either plugged in or not plugged in, and you don't want people to plug them in and then unplug them and forget to plug them back in. So they're very difficult to use that way. But my other question is, so purple air, there was a study at Lawrence Berkeley Lab looking at these different, like $250, $300 PM monitors compared to the $10,000 really first-class monitors that EPA uses but can't afford very many. And it's very, I don't know if you took this into consideration or thought about it. One of the things that was interesting about that study is that actually the purple air did really well in terms of being centered, but it had a lot of spread. So one thing to be aware of is that it has a lot of spread around the center line, but at least the center line of the data is in the right place compared to a gold standard. But it also means that you know, you're measuring, it's a fuzzy measurement in some ways. And I don't know if you've been able to take that into consideration. But again, kudos. I mean, you know, if it weren't for purple air, you couldn't do these studies where you could get so many monitors and use them because they're relatively inexpensive compared to the standard air quality monitoring devices.
Yeah, thanks. Thanks for both those points, Tom. I think one thing that I is important to mention, which I just made passing mention of in my presentation, is that these purple air monitors aren't just like the ones that a consumer, well, they start out as one just like a consumer buys, but then we had them, before we deployed them, we had them calibrated to a stationary, one of the stationary air monitors. And so that takes into, it adjusts for meteorologic or environmental factors like both temperature and relative humidity. And once they're calibrated, they're in very good agreement with the stationary monitoring devices. So they're a little more accurate than what you might just the average consumer might get.
Well, that's a good choice because they actually come with a calibration routine. I mean, you can actually read in the purple air.
I didn't know that consumers could do
that. That actually has a built-in adjustment, which is the standard adjustment from a number of studies. But the trouble with that is it's not site-specific. So the fact that you use the site-specific calibration actually is a really good idea. And that's a really strong point of what you did.
And then one of the other things I just want to stress in some of the data I showed, with the plots, these are just sort of preliminary, quick snapshots of the data. We really haven't taken into consideration the variability in the measurements and whether or not these differences we're seeing are really significant, or is it just sort of noise in the data? And so those will be some of the things we look at next.
Oh. I mean, just one final comment. I watch purple air in my neighborhood, and there are hotspots. Some people must be near like the vent from a restaurant or something, because everyone will be like really low, and then there'll be one monitor that'll be, and I don't think it's a calibration problem. I think it's actually near a source that's very strong, because there are like, there are some of the monitors, outdoor monitors. Now, indoor monitors, that's a totally different story, and you can watch those and see when people are cooking greasy food, because, the outdoor air quality will be 5 and the indoor air quality will be 300. But I don't think that was an issue. I don't think you had a lot of hotspot indoor because they weren't doing cooking or burning candles or anything like that that would drive the monitors off scale or way high.
Yeah.
Okay, thank you so much for that presentation. And we now have the longer stretch here for more discussion. And maybe what we could do is first return to Jenny's discussion points, and then and we'll go from there.
Okay. Yes, please. I wasn't sure if I was supposed to remember what your discussion points were. If you were going to bring them up again.
Seemed pretty tough.
Yeah.
No, I was just suggesting perhaps spreading the word about air pollution measurements to faculty who do studies of physical activity, for example, and have very detailed people wearing monitors where they know they are every second of the day, and they map their location, and they can overlay an air pollution map pretty easily to that data, and they often have samples they've collected. I was just suggesting that, and I can ask people I know too, because some of those are the same communities that had applied for AB 617 money back when, even though they weren't designated. And my other point was just, yes?
I was just going to say, I think that also speaks a little bit to our the development of our RFI, and that we don't want to just get information about air pollution studies, but other studies that could be then adapted to look at air pollutant exposure. So I think the kinds of studies you just mentioned is a great example of that, to make sure that we capture those somehow. Well,
I've also had kind of a long-running battle with our health promotion faculty that they're always promoting exercise, like go outside and run around. And I was like, well, maybe they're better off watching TV if they live right next to the 5 at the border, I mean, I mean, really have to think about these and some of these issues about where it's safe to exercise, which is a really important thing for the community members, could also be an issue. And I only want to kind of emphasize, I think it'd be really nice to encourage intervention studies where there's an actual solution built into the measurement, kind of like with the study we just saw. I think that's really important for communities. So whether it's safer places to exercise, safer times of day, or if there's some kind of piece that could help give direct advice to the communities, I think that would be really good.
Yeah.
And my other comment wasn't super helpful because it didn't have any actually concrete suggestions, but I was just thinking it'd be nice if we could take advantage of this natural experiment that we have of this increased ventilation from COVID related in schools. And if there's anybody that did before or after. I can hear somebody whispering, sorry.
Oh, yeah, to my knowledge, there is not, I don't know of any study where they've done sort of before and after COVID. I would love to, I think that would be super valuable too, but I don't know of any.
Tom,
Thank
are
you.
you raising your hand to add
Yeah,
on to that?
I
Yeah.
raised my hand again with another follow-up. So the monitors are staying in place, right?
Yes,
And how about the indoor IAQ filtering systems?
yes, they are staying in place as well.
One of the things that you might want to look for, unfortunately, it's likely to happen, is a fire, wildfire.
Yeah.
I mean, again, I did this personally, but it's not publishable, but I think you might collect enough data to show the benefits of cleaning indoor air during fires. We saw, I mean, in our house, we just had a MERV 13 filter on our furnace, and we ran it, and we got enormous benefit during one of the fire seasons. You know, the difference you could see in the purple air between indoor and outdoor, a remarkable benefit. And I think the advantage of doing this is to really have the information and even be able to back it up maybe with some biomonitoring, but probably that's a reach. But the whole idea of showing the benefits of using indoor air cleaning indoors, it really can make, if it's done right, it makes a big difference. And how to do it, you know, how to run the filters during wildfire events, and even like some community outreach to convince people to clean. And you don't have to spend a lot of money. There are actually cheap solutions for cleaning indoor air, even with a fan and again, my colleagues at Lawrence Berkeley Lab came up with a very effective indoor air filter where you just go buy a MERV 13 filter, duct tape it onto a fan and run it, and you get real benefits. So you've got the opportunity to show the benefits of air cleaning during wildfires. And again, you don't have to do anything other than wait for a wildfire and then look at the data that you're collecting.
Yep. Yeah, that's a really good idea. And you know, while we left the air filtration units behind, we don't know the degree to which the school is using them. But I'm sure that during a wildfire episode, they would be very motivated to use them. And we're continuing to stay in contact with the school. You know, the purple air data is just continuous, so we can, you know, grab that anytime we want. But I think that's a great idea, and we could, even if we, you know, see a wildfire episode developing down there, we can reach out to the school and say, hey, make sure you got those, you know, going, and then we could do a really nice little analysis just to evaluate their effectiveness. So thanks for that.
Okay.
Other points of discussion on this, we could, Susan, you might want to put up your slide that have sort of further prompting discussion questions for more input on this topic about thinking about these sort of short turnaround studies on an annual basis, and input on how you might solicit those projects in a more systematic way.
So this one, I guess, is what you're thinking. So, yeah, as I think I said, we're just starting discussions within the program about how we might develop an RFI to develop a kind of a long-term strategy for soliciting ideas for these studies. We're not sure whether or not we would do one RFI, one to academic researchers versus a different one to community organizations. I think we still need to work that through. So some of our questions are, what types of information should we collect to help evaluate both the feasibility of these projects as well as the potential impact? And then just generally, what should the process look like? Is it a one-time process? Do we have it just sort of continuously open, and then we have a certain time each year where we go in and look at the ideas? Or do we reissue it every few years? And then the other thing is, we're not seeing this isn't like an RFP where there's a formal application and a formal scoring system, and then we choose the one that's got, the highest score, or the few that have the highest score. So I think we need to think about, after we get this information, what should the follow-up process look like, and how do we convey and set expectations to those who submit ideas? So these are just discussions we're starting to have, and we'd love to hear if anyone has thoughts on any of these issues.
Thank you. I think Jenny had a question that is maybe relevant to this in thinking about subsequent studies. Jenny, about location of the intervention.
I just had a quick question following up on previous comment about air filtration, because there are studies on interventions going on other places, so wildfires and filter study. I think there's one going on in the state of Washington by School of Public Health at the University of Washington. And so I'm assuming samples have to be from California residents, but it occurred to me I didn't know that if that was true or not, if it was a very interesting question to California residents. So that was one question. And the second just comment was, perhaps you should loop in some kind of community review of the projects too. Like, for example, the AB 617 Community Steering Committee or Community Advisory Committee, whatever it's called, that statewide could perhaps kind of give feedback onto what they thought was the most interesting or something like that, as well as just you guys reviewing it. Sorry about my dog.
So to answer your first question, yeah, these do have to be conducted in California. And yeah, so I think regarding your second comment, I want to make sure I understand you right. What you're suggesting is, in evaluating the ideas, we should make it a broader process and not just involve program staff, but others, community, CSC member or CSC, AB 617, people who are involved in AB 617 and others. Is that?
It was just an idea. I was just thinking that, again, the Tobacco-Related Disease Research Program, I was thinking about because I just submitted a grant, but they went to having community reviewers as well as kind of academic reviewers to give feedback on not so much the science, but whether this was important to do or not. And just maybe a similar model or something like that.
Yeah, that's a good idea. I like that.
I appreciate that point about community review, and it connects. I think we've talked a lot on this panel, and the program has thought a lot about the value of intervention studies. And I think those are often also really appreciated by communities for the benefit of taking action at the same time as, not only continuing to be studied, but a study that includes measuring the effect of an action. I think are often very well received. We don't have to limit our discussion to this RFI process either. So anything, I wanted to raise these questions so that Susan would get the input that the program is requesting, but we can talk about anything. Lara.
Thank you. I wanted to echo the suggestion for community review. I think that's a great idea. It might be challenging on this sort of 1 year timeline that you laid out to, just build in time for that. And then Meg's comment about interventions, I think another area that might be good to focus is like projects that can inform policy and to reduce exposures and like active policy processes and debates. Earlier was mentioned that you are collaborating with the water board, I think it was, to look at biomonitoring of PFAS in relation to drinking water, samples of PFAS in the context of developing, regulatory standards for PFAS. So that's like a great example of, and I think for communities, that's also an important consideration is, again, as Mike said, like not only documenting problems, but also informing efforts to reduce exposure, and interventions is part of that, and policy is part of that too. So I just want to put in a plug for that. Oh, and then I had a very quick comment about the process is that, in my opinion, having a deadline will get you more submissions than having an open, continuous process, just because it makes, people turn something in. So you might think about that.
Excellent point. Thank you for both those comments.
Maybe I'll take this natural pause. Ulrike, I see you all. Since I started calling for the comment, let me just check and I'll get you next. Just to check if we have anything that came in on the email to the OEHHA, or if there's anything in the room, Stephanie, questions or comments that we should get in here.
No comments from the room. Thank you.
Yeah, I don't think anything new is coming.
Okay, great. Thanks, Ulrike.
Yeah, I just wanted to just address what you, in your topic for discussion, whether it should be open, to both community organizations and academic researchers or separate RFIs. I mean, I think it, one of the strengths of a lot of the studies that Biomonitoring California, have had is, having partnerships between community organizations and, Biomonitoring California, or in this case, if you're having an RFI, to look for ongoing collaborations where you already have, the community organizations maybe working with academic researchers. So I wouldn't necessarily separate the two, is what I'm saying.
Susan, do you want to put the other questions up just so we get a moment to look at those before we conclude the discussion? And then I think, Jenny, did you have a question or a comment?
Meg, Martha Sandy also has a comment.
Oh, okay.
In the room.
Sorry, this is Martha Sandy of OEHHA. I just wanted to follow up on Susan's response to Ulrike. I think what we're hoping that our projects are collaborations between communities and academic researchers. And I mean, that's what we've been doing in the past. That's what we hope to do. But we're wondering if we want to get an RFI, put out an RFI to community groups and hear from communities what they're worried about. We could then, if we chose to act on some of that information, work with a community group and find academic partners to help us do the study. I just wanted to say it's not either or. It's like, but do we frame an RFI that a community organization or communities would be more likely to give us input? We're worried about this kind of air pollution and these effects we have in this environment, something like that. And then hear from academicians who have ongoing ideas and proposals of certain studies and interventions. And either type of response we would put together the communities and the academic partners. Thank you.
Thanks for the clarification. Yeah.
Thanks, Martha. Jenny.
I guess one thing I'm not clear about, but was this only an RFI for basically getting samples mailed to you? You know, or is there money for the community groups to, you know, have a partner with a clinic and collect urine samples and ship the samples on dry ice, or what? I think you should be clear about what kind of money is available beyond offering free analysis. Basically, you know, how much would be available, or is this something that community members could kind of get together and provide urine samples, for example, close to the agricultural field and far from the agricultural field, or would, you know, I just thinking about like how many resources there are to obtain samples versus get already obtained samples, to make it clear in the process, I guess.
Yeah, well, just to clarify here, because yeah, I agree that would all have to be very clear when we're issuing the RFI, but there's 350,000 each year allocated to this, and so we can use that in a variety of ways, but we can certainly use it as we did with SAPEP, to go out, you know, work with a community group, identify a site where we can do the study. You know, our community partner helped us identify the school and get us into the school, and then collect the samples, design the questionnaire. We did that all in collaboration with the community partner. And there is the ability to for some of the money to go to the community organization. It can't all go. There's a cap on that, but we do have the ability to support community partners in actively being engaged in the study. So this wouldn't just be like Biosphere or like the prior RFIs that we've done through the program where we're just looking for samples. I mean, we really can, and we want to be doing that in the future. We want to be doing more of that. And we're hoping the RFI will lead us in that direction.
That's great.
Susan, do you want to put up the other questions that you had in case that sparks some? We're almost to public comment period time, but just if there's any last thoughts.
Yeah, we already touched on some of this in the prior discussion after Kathleen's talk, but you know, we're just thinking, you know, the program has done well. So with our community biomonitoring studies, we're just now working on the results return for SAPEP. And as part of that, we will be having community meetings to share the findings. You know, after we return the results to participants, we'll be having community meetings to share the overall study findings with the community where we did the study. But we really want to start thinking more about then how do we disseminate that information further so it can be useful to other communities that are similarly burdened, to other communities that, you know, may be interested in using the same kind of air filtration. So we're just wondering if people have ideas on how we might provide information that's will expand its dissemination to other communities that can use it, and what should that information look like? You know, how what's the best way to get that out? And you know, I think Tom mentioned the use of, I think it was Tom, social media earlier, and you know, I think it's uncharted waters for us, and it has a lot of potential pitfalls, but it has a lot of potential also. So that's, you know, one idea. But I guess just kind of, if anyone has any ideas of how we can make sure that our study findings aren't just used in the, you know, the small community where we're working, and that it can, how we can maximize the impact.
I lowered and raised my hand, Meg, just so you know.
Thank you. Jenny, please go ahead.
I just was thinking that since AB 6117 really hugely increased the engagement of the local air districts, and they usually have Twitter and all kinds of stuff going on. It's possible, perhaps, if it's air related, you could give it to the air districts and they could disseminate it through their dissemination community outreach people. Would be one point.
Good idea.
Put out a last call for comments because then it's time for us to turn to the public comment period. So hearing none, thank you so much, Susan, for this presentation. It's great to hear about these results and really look forward to seeing the process evolve.
Thank you.
So we have 20 minutes in the agenda that are allotted for the open public comment period. And commenters during this time are welcome to provide comment on any topic related to biomonitoring California, not just the topics that we've been discussing today. So if you're attending the webinar, you can submit written comments and questions through the Q&A function of Zoom or by emailing biomonitoring@oehha.ca.gov. Or you can speak by using the raise hand feature, and I can call on you. And if you're in person and you wish to comment, you can come to the podium in the room or raise your hand, and Stephanie Jarmo will make sure that you are heard there. So let me check in with Cheryl about any, I don't see any raised hands on the webinar, and Cheryl can tell me if there's anything by email.
No, nothing new has come in. Thank you.
And we can leave a few moments here in case people hadn't already managed to put in a request or a comment. This is the last item on the agenda, so I can leave a minute or two. And then on site in Oakland, Stephanie, is there any comments we should tend to?
No comments from the room. Thank you.
Okay. Jenny, did you have something to add?
I had a public comment, I guess, that I wanted to we had a lot of discussion about communities and disadvantaged communities for biomonitoring, and I wanted to just remind all of us that we had talked about occupational groups as being also an important group to monitor, and I'm thinking of perhaps exposed to pesticides and other things. I think that I'd like to just raise the importance of occupational exposures, to this future work as well.
Thank you for that. And Cheryl, if there's nothing else that has come in online, I just wanted to leave a moment in case someone hadn't had a chance to submit a comment. Then let me just check in and make sure there's nothing else.
Yep, there's nothing else. Thank you.
Okay. In that case, we can wrap up and adjourn just a few minutes early. A couple of announcements before we adjourn. A transcript of the meeting, as usual, will be posted on the Biomonitoring California website when it's available. The next Scientific Guidance Panel meeting will be on November 18th, 2022 from 1 to 4 p.m. And there will be more options available about attending that meeting, and that information will be made closer to the meeting. So I want to thank the staff who organized this meeting, and particularly to Kathleen and Susan for your presentations. It's really helpful to hear progress and inspiring. And thank you to the panel and everyone else who participated in the meeting. And with that, I'll adjourn the meeting until